Okay. Hi, welcome to the last Wellness Wednesday. Can you all hear me correctly? If someone wants to unmute, how's the audio today?
Yes, you sound fine.
Okay, thanks, Christina. Okay. Uh, Today's discussion number 6. We're going to go over home safety. We have Tim Stevens here. He is near and dear to our heart. He works with Home Safety Services. Um, they are They are our trusted licensed contractors here at Healthy Aging Association for our Dignity at Home program. So Vanessa, our program coordinator, works a lot with Tim, and so it's great to have you, Tim. I'll let you do your introductions in just a moment. We will disclaim that this meeting, as always, is being recorded for your convenience. We will upload it onto YouTube. Usually, I do this within the next 24 to 48 hours, and you can watch it at any time over there. The username is at the bottom of the screen, and I will send out a link after our presentation when the YouTube video is uploaded. So, hello to you, those that are watching on YouTube today. Okay, we start with our welcomes. The purpose of Wellness Wednesdays are tied to our Dignity at Home Aging in Place program. And so they're intended to educate the community on fall prevention, which is one of the biggest program or the most popular types of programs that we have, right? We do the Young at Heart Fitness classes that promotes fall prevention, our Matter of Balance discussion class, and then we have our Wellness Wednesday programs as well. And so, our mission here at Healthy Aging Association is to help older Americans live longer, healthier, more independent lives by promoting increased physical activity and sound health and nutrition practices. So, Tim, I would love for you to get into your presentation today, and the stage is yours, please.
Well, thank you very much, and good afternoon, everyone. My name is Tim. I'm with Home Safety Services, and I would like to first thank Healthy Aging for such a long-term relationship in helping to prevent falls throughout the county Modesto area. We've done quite a bit of work together, and it's always a joy to work with Diana and her team in helping to prevent falls throughout the home. So just a little brief introduction. If you go to the next slide. So this is the 30-second commercial for Home Safety Services. So we are a regional home modifications company. We service most of Northern and Central California. We've been in business for almost 30 years. Our home office is based in Burlingame, but we have techs that live all throughout the state. In fact, we have a tech that lives right there in Modesto, and he does all of the installations for Healthy Aging. We also have a operations office up in Sacramento. So we are based all throughout the state, and we service a fairly large geography. We are licensed, bonded, and certified. We have our contractor's license. We are Joint Commission accredited, which we are most proud of. If you don't know what Joint Commission is, we have the same accreditation that hospitals, skilled nursing facilities, and other medical institutions have. And we are the only home modifications company on the West Coast, and I think in the United States, that has that certification. We went out and received that certification so we could place ourselves right in the healthcare continuum and be part of the care management team. All of our technicians are hired and trained by us. We don't hire subs. We don't pull in people off the street to do various odd jobs. Our techs are trained in a 6-month program, and they all have their own trucks. They all have their own tools, and they go out every day and service clients. Next slide.
Reloading. Give me a second here.
That's right. I've been
Okay.
in Zoom problems all day long.
Oh no.
So yeah. So what are home modifications and their benefits? Very briefly, they are minor household upgrades to your place of residence. They provide patient safety and independence. They allow you to age in place and live there longer, which is usually the number one objective for most people as they age in their home. It also decreases healthcare costs. If you're interested in a lot of statistics, please contact me afterwards. My information will be on there. I can supply you with pages and pages of healthcare costs and how they're affected by home modifications. And of course, why we're here is they reduce falls. Next slide. So falls prevention is a lifestyle, and I know healthy aging is all about this lifestyle. We're going to talk about one aspect of it. Go ahead and click. So exercise, very important. Click. Healthy nutrition, very critical. Hydration, very critical. Medication management, go ahead. Vision and hearing, which a lot of people don't think about, but if you're experiencing vision loss, it's very hard to navigate your home. And then also hearing. A lot of people don't think about hearing, but if you're having trouble with audible sounds, it can throw off your balance, and then, of course, it can result in a fall. And then, of course, what we're going to talk about today here is environmental, which includes clutter, pests, hoarding, lighting, shoes, and of course, home modifications. So this question comes up quite a bit. So who actually pays for home modifications? Of course, private pay individuals, that's a big part of our business. The VA pays for home modifications. So if you are a veteran and you are in the VA medical system, they will pay for 100% of home modifications, not just a grab bar, but all the way up to a bath remodel. There are just amazing benefits for our veterans when it comes to home modifications. And if you need more additional information about this, once again, you can contact Healthy Aging or myself, and we can point you in the right direction. Workers' comp, so if you're out there working and you have a fall, obviously, that can be covered too. Medicare Advantage plans, which is Part C. I'll just let you know it is a covered benefit in Part C, but not all health plans have this benefit included. They're not required. They can add it on as an add-on benefit. CalAIM, which is Medi-Cal. So Medi-Cal in California recently started a program about 2 years ago that includes home modifications. There's a lifetime cap. There's a following slide. I'll get into it a little bit more in depth. Area nonprofits, which Healthy Aging obviously falls under. City, county, and state programs, which we call CBGs. Those are community block grants. They can receive funds for certain home modifications. Your long-term care insurance has riders that will include home modifications. I will caution you, though, that the insurance companies don't make it easy for you to find those riders, and there can be kind of time-consuming to access that. And then, of course, health insurance, our private healthcare insurance, may fall under DME. It's very rare. So I'm going to pause here to see if there's any questions. I know I went through a lot right there, but if any questions? Okay, moving on. You guys are still digesting lunch. I get it. So CalAIM, I just briefly mentioned that. I wanted to go in a little bit more depth and detail about this. So once again, it is Medi-Cal. So Medi-Cal members, if you're eligible for Medi-Cal, you're automatically eligible for the CalAIM benefit. There's quite a different layers involved with CalAIM, but I will only talk about home modifications. You do need to be a plan member, nursing home eligible, and then there needs to be a medical necessity. What is medical necessity? You go into your doctor, you say, I've had a fall, or I'm worried about falling because I slipped recently in the bathtub, and it's a condition that is exacerbated by your diabetes or anything like that. That will predicate medical necessity. Go ahead and click. What is the benefit itself? It's full spectrum home modification. So it could be all the way from a grab bar to a ramp to a lift or anything in between. There's a $7,500 cap. That is a very generous cap, and it will cover most of the home modifications you'll see in the preceding slides. But it does exclude DME. That would be your shower chairs, wheelchairs, hospital beds, oxygen tanks, and things like that. Go ahead and click. Oh, so protocol, referral, any door. So anybody can refer a Medi-Cal member. You can yourself, if you're that member, your neighbor can, your doctor can, the health plan can, a nonprofit can. It's very easy to refer a member for CalAIM. There do need to be an OT assessment, which is an occupational therapy assessment. Then there's an estimate on how much the work will be. It's authorized, and then the work comes back to the contractor, which we are one of the contractors in the CalAIM program. Next slide. I'll pause for questions. Okay, next slide.
Okay.
We're rolling along here.
We
So
are.
now is part of the presentation. I'd like to get people involved here. So just go ahead and shout it out. Where do falls occur? Make sure you're
Restroom.
off mute. What was that?
Restroom.
There you go. Go ahead and
Kitchens,
click. Kitchens, good.
bedrooms,
Bedrooms, very good. Garage, bedroom. You guys are tracking. Anything else?
Gardens. Get that a lot.
Garden outside. Yes.
Yeah.
Stairs. A lot of any changes in elevation in the home. Walking out to the outdoors where there's a threshold. It could be sometimes maybe just an inch high, and it's a place where you can trip. Go ahead and click. And this is the definitive answer. It can happen anywhere in the home, outside of the home. They track falls in hospitals. They track falls in places of business. Falls can occur just about anywhere where people exist. Go ahead and click. So I wanted to throw this in. This is a picture of how you shouldn't carpet your stairs. And you can obviously see why. There's a lot of issues here, but please don't carpet your stairs like this. Go ahead and click. All right, so this is an actual picture of a typical home that we see on a weekly basis. Can anybody tell me some of the problems that you see here? Go ahead and come off mute if you have an answer.
You could type it in chat too if you prefer to do that. I'll open it up the chat box for you.
Okay.
Oops, sorry.
So any answers? See any potential falls problems here?
A lot of clutter
Clutter, very good.
on the steps and that hanging clothes you can't see.
Very good. That's exactly right. So we have the clutter. That's a huge issue. The clothes on the wall. You see that little brown box on the wall. That is the doorbell chime cover. That is at arm level. That's not very great placement for that. You see the cushion at the end of the landing there. Funny story. Well, maybe not so funny, but that cushion was put there by the owner because he kept stumbling down the stairs and he kept falling into the wall and he got tired of hitting the wall. So he put the cushion there. So obviously we have some problems here. Sometimes the length of the carpeting there, if it's a deep shag carpeting, that could be a problem. What we did here is we obviously made the recommendations to clean up the clutter, and then we installed handrails on the opposing side. Good. Next slide. All right, so we already talked about, I gave you a little hints on the first one there. Where do we see falls risk on this slide?
That carpet at the bottom of the stairs.
Very good.
Or
Yep, very good. Anything else? Anybody see anything here that could pose a problem?
The shoes.
Shoes, very good. Clutter, more clutter. You see that cane down there? What was that? I'm sorry.
pictures are hung too low.
Very good. How about just the pictures in general? That's a glass mirror. Someone who is what we call wall walking down the wall because they're unstable. That is a very dangerous placement for that picture, but you're exactly right. Anything else?
that other mirror that's leaned up against the wall. Between
There you
the
go.
wall and
Yeah.
the chair.
Mm-hmm. That's more clutter, more clutter. You see that cane down there? I don't know if the homeowner is upstairs or downstairs, but you know, if they're using a cane and they need it, it's not with them, so that's a problem. I'll help you out here. A couple things. How about the insert for the stair railings itself? They're glass. They look very pretty, but it's very dangerous as they're coming down. You could put your foot through it, or you could fall and put your hand or arm through it. And then the reason we were brought in, and it just popped up, is no opposing handrail. So go ahead and click the next one. So we came in and we had them remove the clutter, remove the mirrors and the pictures on the wall, and we installed an opposing handrail. And if you look at the pre-existing handrail and the hand that's on it, you noticed how wide that is. Go back to there you go. That is a very large, abnormal width for a handrail, and you can't really put your hand on it. I guess you could if you were Shaquille O'Neal, but the average homeowner is going to have trouble navigating that handrail. So it's just something to point out. They did not change that, but it is something to be concerned with. All right, you guys are getting the hang of it. Okay, next slide. All right, so what are the home modifications that are available out there, and where did it start? You know, everybody is familiar with grab bars. Grab bars, they've been around for years and years. They come in all shapes, sizes, colors, textures now. They can be custom made, custom shaped. There really is no end to where a grab bar can go. It's not just exclusive for the bathroom anymore. We put them in the garage, we put them in kitchens, we put them at front doors. They are just about everywhere where there is assistance needed. I'll pause for questions. All right, next slide.
All right. Oh,
So we see this a lot. We hear this a lot for the suction cup grab bars. We are not fans of them. We've never used them. We never will use them. They do give you a false sense of security when you grab onto them, and they can come off. We just don't advocate them at all. It seems like every 2 or 3 months, a new technology comes out. We take a look at it, and we just are not fans of these temporary grab bars. All of our grab bars are placed right into the wall. If we can't find a stud, we do have special fasteners that we can use. We can use those when studs are not involved, or in mobile homes, or in apartments where we can't find suitable placement for the screws.
absolutely.
Questions?
I do have
Oh.
a question.
Sure.
On the topic of grab bars.
Mm.
I'm in a rental and the bathtub is those full enclosure fiberglass.
Mm-hmm.
How would one go about putting grab bars on that without cracking the tub enclosure or something?
Okay, that's a good question. So a couple things here. We do have special fasteners that we can use to fasten into fiberglass. We also have special drill bits that we can utilize to drill into different substrates. So fiberglass is one, marble, granite, tile. We have many different ways that we can drill through these substrates and get into the stud if needed, or if there's not one involved. We've installed over 50,000 grab bars, so we have a pretty good track record. And I'll give you a kind of a side note. We actually have our competitors will call us with jobs when they are uneasy to drill into certain tile or marble, and we do that quite a bit up in San Francisco. We're kind of considered the experts in drilling into those types of surfaces. So hopefully that answers your question. I would like to add, since you brought up rentals, this question usually does come up about installing home modifications in rentals, and where the landlord and the property managers become involved with this, and they say you can't do that. So California and federal law has a clause in it called reasonable accommodations, and that law states that landlords and property managers must make reasonable accommodations to make your dwelling safe, and that does include home modifications. Now, they don't have to pay for them, but they do need to make that dwelling space livable and safe. So I just wanted to add that if that question comes up. And as a company, we can help out and talk to your landlord or property management company. And I know also Healthy Aging does that probably on a very frequent basis.
Yeah, we do actually. We'll go into that. There's one other thing that I've mentioned before in our other discussions, but when it comes to these suction grab bars, something you also want to consider is mold. Mold accumulates in these very easily, especially if you were getting material that's a little more cost effective. It can definitely create that mold buildup. So we just don't recommend them. In fact, we went to a home assessment yesterday and I saw one of these, and then I saw two on the bathroom floor. And the client, she let Vanessa and I know that it's actually slipped off on her while she's been showering, and she's terrified. So, as Tim's mentioned, I just don't recommend that you go this route whatsoever.
Yeah, and if they become moldy, they become slippery because that interrupts the suction also. So bottom line, we don't use them when we do not advocate them. So moving on, there are a lot of different options in and around the toilet for home modifications and to keep you safe from falling. There are toilet safety frames, there are fold-down grab bars, custom-made grab bars. There's what you see down in the corner, which is a toilet lift. It actually comes with a remote. You press the remote so it can actually meet the individual. They can transfer usually from a wheelchair. And then when they're finished, they can raise themselves back up and transfer back into the wheelchair. That's a great product for certain people who have very difficult conditions. You see in the upper corner, that is a portable bidet. Those are becoming more and more popular. In fact, the cost has come down on them. They don't require advanced plumbing, construction, or electrical connections. So it's a great solution. Next slide. All right, I threw this in. This is a bath safety package, and this is generally what people move to when they first start getting some home modifications. You know, they're worried about falling. They've never thought about this before. They haven't fallen yet. I'm just, I'm worried about my wife. I'm worried about my husband. And what it includes is a bath safety bench, 2 to 3 grab bars, and then you see that handheld shower there, which is really nice. And that has an automatic shut off, so you can lather up, turn it off, and continue to soap up. And then when you're finished, and you don't have water running all over the place, and then you can turn it back on. There's an automatic shut off valve at the head of the shower. And this is a great package. It's economically priced, and it's just an overall fantastic option for starting your home modifications in your shower or bathroom. Questions? All righty, next slide. All right, moving on. So we install ramps, and ramps are a great solution in and around any transitional changes, obviously steps. As a company, we only install modular aluminum ramps. We don't do concrete ramps. We don't do wooden ramps. There's a couple reasons for that. Modular aluminum ramps, in most cases, do not require permits. They're very easy to install. They're very easy to uninstall and remove. They don't leave a large footprint after they've been uninstalled. Usually you can't even tell they've been there. They're recyclable. They're reusable. You can clean them. They don't break down in the weather or insects don't bother them. They come in all different shapes and sizes. You see the smaller ones in the corner there. The black one is a rubber threshold ramp that can be utilized for smaller transitions, say from your kitchen to your outdoor area, or what's called a suitcase ramp. And it's called that because it actually folds up and there's a handle and you can carry it with you. A lot of people just put these in their cars when needed, and it can be easily placed for just about any small transition of 1 to 2 steps. Next slide. All right, moving on to railings. So railings, as we've seen in the first couple slides I showed you, are a critical piece of the puzzle when it comes to falls prevention in and around stairs. As a company, we manufacture our own railings. They could be metal or wood, and they're just like grab bars. They come in all shapes, sizes, colors, textures. We can design them to fit any decor of the house or outside the house. You see a very long black railing there with step extenders. That's a great solution for people who with walkers and they're having difficulty navigating small steps or landings. You see the transition there in the middle. That particular picture is quite common in the Bay Area. A lot of homes were built in the 50s and 60s, and for some reason, the garage was usually set lower than the main living area. And I know from personal experience, I grew up in a home like that in San Jose, and the drop down was almost 31 inches, and it had 3 or 4 steps. It was crazy. It's like I could never figure that out. But there are a lot of homes in the Bay Area and probably in the Central Valley that have a similar transition from the main house to the garage, and it's very easy to put in a railing and fix that solution. Questions? All right. So moving on, we have lifts. These are a great solution. Once again, stairs. You know, you're hearing stairs a lot. Stairs are one of the leading area for falls in a home. And solutions for stairs, you have a stair lift that works indoors and outdoors. We also have toilet lifts. We talked about that. You see a bath lift there. That's a great solution for a person having difficulty bathing or transferring into a tub. Excuse me. That does have a waterproof button clicker, and what the person can do is just transfer over from a sitting position. They hit the button and it lowers them down into the tub. They take their bath, and then when they're finished, they just click the button and it raises them back up. Great solution. And then for more advanced cases, you see that one towards the bottom in the middle. That is an overhead lift. Of course, a lot of individuals are wheelchair bound at that point, but that overhead lift can be placed just about anywhere in a home. The beauty of that is it articulates in many different directions and degrees, and it's just a great solution to transfer people from a wheelchair to a bed, from a bed to the wheelchair, from the wheelchair to a tub or shower enclosure. It is just a kind of a one-stop all overhead lift. Next slide. So transfer poles, another great solution in and around many different areas around the bed. It's utilized a lot in the bathroom. You see the gentleman there. That horizontal bar that he has his hand on articulates in 360 degrees, and it locks in at each degrees. So it is a dual purpose. It can use that to get into the shower and back out of the shower. Same thing with the bed. You can use that to transfer from standing or sitting onto the bed. And then when you want to remove yourself from the bed, same thing. You can just adjust that horizontal bar and you can transition safely back out of the bed. We are putting those in bathrooms and bedrooms, in living spaces, living rooms, dining rooms. I've seen them in the kitchen and also places of business too.
Question for you,
Sure.
Tim. When concerning the restroom, is there a preference over the transfer poles or the grab bars? As far as home safety services goes, do you recommend one over the other, or is it just individual preference and cost?
So that's a really good question. And the answer to that is it depends.
Okay.
And not to be vague, but you know, our technicians are trained in installation and assessment. So if there has not been a clinical assessment done at the home, we can take a look at the health of the patient, what their living condition is. Are they wheelchair? Do they have a wheelchair? Do they have a walker? How do they move? How do they walk? Is there a caregiver in the house? What's the health of the caregiver? You know, you may have a a very large spouse and then a very small spouse, and both of them may have health conditions and they may not be able to assist as much, but there might be a paid clinician there or a paid caregiver. So it really depends on the situation. It also depends on how the bathroom is constructed. You see that one picture there. That's a step-in tub. That creates problems. So a grab bar might not be perfect because that individual's having trouble to transfer. Maybe that tub needs to be removed. So that's another. Maybe there needs to be a tub cut out. It really depends. So that's a great question. I'm not trying to be vague, but it depends on the environment and the condition of the patient.
Yeah, great. Thank you.
So I wanted to throw this in. This is another maybe more extreme and also more expensive solution to a problem. This was a job we did up in San Francisco. The individual had no problems until I think they had a stroke or a heart attack, and then they couldn't access their shower to have their to be clean. The threshold on that, if I remember correctly, is about 12 inches. So that's a pretty big threshold. And also when they opened the door, it banged into the sink. So it creates a problem. So what we did was we removed the sink. We actually put it around the corner. You can't see it. And then we reconditioned the shower, pulled the existing shower out, and we put this modular shower unit in. It came with a teak bench, grab bars, handheld shower, and then we replaced the sink there with a grab bar. And by the way, there's no threshold there, so they could roll in with a wheelchair or walk in with a walker. So it's a really good solution to take care of a problem. Next slide. This is a portable shower. It is a fantastic option for someone who has many levels in their home and there may not be a shower or bathing area after coming home from a hospital stay or a skilled nursing stay. It folds up nice and tight, so storage is not a problem. It will accommodate a chair, a wheelchair, or a walker. It has a pump for pumping out the water and also a pump to pump the water in. It can connect up to any water and drainage source. So you see there in the kitchen, they're just connected up to the kitchen faucet and they drain it into the sink. You could put this into the garage. You could put this into a half bath. It's a very inexpensive solution for someone bathing without access to a shower or tub. These products are manufactured in the Bay Area in San Leandro. It is a local company, and it is just an amazing solution. Questions? All right, just a couple case histories here that I threw in. These are actual jobs we did under the CalAIM umbrella. We see this very frequently. Someone's doing fine in their life. They fall, break their leg or their hip. They go to the hospital. They go to the skilled nursing facility. And when they come out, they're in a wheelchair and they can't access their home. So their family or their caregivers throw down a couple planks of wood. That works fine for several weeks, but as the time goes on, the sun degrades them, the rain degrades them, and the bugs get to them, and it cracks or it weakens, and it poses another falls problem as they either walk up it or their wheelchair goes up it. We came in, we installed, this is a 6-foot ramp. It probably took less than an hour and a half to install. It was very inexpensive. They utilized that for a couple months. And then when they were able to walk unassisted, we came in and removed it, and you couldn't even tell that that ramp was there. Next slide. Same program, CalAIM. They couldn't access their stairs or their house through those landing steps for whatever reason. They ordered up a custom railing that was manufactured in Burlingame. It probably took less than 3 or 4 weeks to have that manufactured, and we came back out and installed that, and now they can access their home unassisted. Questions? Next slide. So next steps. Mentioned all along, don't wait until you fall. Unfortunately, we still have a lot of clients who they're getting older. They may have some health conditions. They don't think they're subject to falls, and then they have a fall, and then they call us, which is it's not optimal, but we still see that quite a bit. Talk to your doctor or your caregiver about falls. Maybe have a home assessment, home safety assessment, either by a local agency like Healthy and Aging. We can also do that too. We can do virtual assessments if need be. Go ahead and click. Click. And I think that is it. That's my information. And I will open it up for questions.
I have a question.
Sure.
Do you also deal with things like, those push button door openers like you see in businesses? Push the button and it opens the door.
Automatic doors.
Yeah.
We have traditionally not done those. We can. It just depends on the construction needs. We only do home modifications. This is all we do. We don't rebuild homes. We're not building ADUs. We're not pouring cement driveways. So our scope of services, we try to limit when it involves more construction or permitting. If we have a job that looks like it's going to require more work than we would traditionally spend on a job, we would usually refer that to someone else. Jobs like you're describing can be very simple, but they can also be very involved.
Okay. And then what about on the other end of the spectrum, simple things like door handles, things, for gripping easier, or something like that?
So if it's part of one of our jobs, yes. And what I mean by that is we do what's called door widening, and that allows people to maybe it's not wheelchair accessible. We can actually do things to the door to widen it. We can also reconstruct the actual structure of the door. And if that's part of the job, yes. If you called us up and said, I need all the doorknobs changed in my house, we probably would refer you to someone else.
Okay.
Good questions, Christina. Any other questions for Tim today before I move on?
I'll just close this. Thank you very much for your time and
Thanks, Tim.
attention. We had just a personal aside. We had my neighbor across the street. She's older. Her husband passed away. She was having mobility issues. Her family and myself, being in this industry, we'd been after her to do certain things to her house. Get a personal surveillance, not surveillance device, but a personal emergency device. If I've fallen, I can't get up button, and also get some home modifications, a couple railings, and to just be more connected to the fact that she's not getting around as well as she could be. Long story short, she fell on a Saturday morning, and no one got to her till Sunday evening. She couldn't reach her phone. She had to scoot on her back over to a certain area. She fell in her garage, and it was a big problem. The fire department had to be called. The ambulance had to be called. It turns out she was all right. My point is there were signs that you see and that are usually quite evident that falls could happen. And she didn't believe that she could fall and it could happen to her, but it did. So I highly suggest if you're just uneasy, just get it checked out.
Absolutely. I'm so sorry to hear about that, but hopefully she's doing okay and her needs are being met.
They are now.
Good. Great. Okay, we're going to move on to Dignity at Home. Tim, I know you've got a busy schedule. If you need to head out at any time, please do so. Otherwise, I invite you to stay. But our feelings won't be hurt here. So thank you again. Going on based on what Tim said about resources and who does the the in-home installations. So we can provide the monetary assistance as well as the in-home assessment. And Home Safety Services and Home Safety Services solely, they are our contractors for this program. Some of you may have already been in it or know about it, but it's our fall prevention program. We are funded by HUD. We just received that grant a few months back, and so we've been working to secure everything, and I think we're at a good place right now. Besides a government shutdown, which is stalling a little bit, so hopefully that opens up. But what is our Aging in Place Dignity at Home program? We do the home assessments, which include kitchen, your bedroom, your main bedroom, your main bathroom, and then your exit and entry. So this could be a preferred exit or entry. It doesn't have to solely be the front door. If you prefer entering through your garage, we could take a look at that. Or if you prefer entering through the back exit, we could take a look at that as well. And then we do a second home assessment for quality assurance, just to make sure that Healthy Aging Association has met your needs and everything, installation went smoothly. And so we will come back in 30 days after Home Safety Services provides the installations and check everything out. And then within this program, we also provide fall prevention education. We point out hazards in the home during the home assessments. We look at your lighting. As Tim mentioned, we look at both your home security systems and ask about personal security systems. And then we provide tons of county and Healthy Aging Association resources related to fall prevention and mental health too. And then thirdly, or Home Safety Services provide the injury prevention accessories. So her scope is not as big as Home Safety Services themselves, which is why I'm really happy that Tim has listed other resources for you there, because we really focus on grab bars, outdoor hand railings, the threshold ramps. So both the small one, those are the most popular, just trying to, maybe get from that kitchen to the backyard. But we also do the ramps that you'll see. Tim showed a picture earlier, the aluminum ones with the handrails on them. And then we do toilet seat risers. So it's not the toilet seat that lifts up for handy-capable individuals, but it has the hand railings on it so you can securely lift yourself onto the toilet and sit down onto the toilet. Removable shower heads with a shower bracket. That's a very popular item that we do besides the grab bars. And so that is our main scope of the fall prevention accessories that we're able to provide through this cost-free program. Now, who qualifies for the program? The 2025-26 requirements have changed a bit with this HUD grant. You need to be at least 62 years of age. You need to have had a fall or be at risk of for falling, and typically, and unfortunately, most individuals who come through to our program have already had a fall. So I recommend being proactive about this and not being on a garage floor for over a day until someone finds you. Be proactive. We have the resources available for you. The income requirements for a federally funded program, it's actually fairly forgiving here. So I've listed the prices for you. If you are interested, you think a neighbor might be interested, this is the income requirements. And so, like I said, pretty forgiving for one person. If you make under $55,200, you would very likely qualify for this program if you are at least 62 years of age. Now, falls are absolutely preventable, and the application process is really easy. our participants do not need to come into the office. Everything is either over the phone, or Healthy Aging comes to you, or Home Safety Services comes to you. So you do not need to leave your house for this program, which is very inclusive and accessible to individuals who very likely need our services. The application process for our Dignity at Home Aging in Place program requires a pre-screening, which is over the phone. We really like to get to know our clients here and like I've preached over and over, meet their needs. The phone interview comes after the pre-screening a few weeks later. It includes a registration and, most importantly, the fall assessment score. And so we'll ask a multitude of questions related to falling, and then it's like a Likert scale. We add it up, and then at the end, the highest amount of points you can get is 30. If, let's say, you have 25 points out of 30, you would be a high priority client. So we do prioritize our clients here. Then comes the in-home assessment. We talked about that briefly earlier. We refer to Home Safety Services. They come out and install, and then we provide the follow-up assessment 30 days after installation. Now, right now, things are a bit different due to what's going on with funding, but when everything gets back to normal, the realistic time frame with this new grant is around 3 to 5 months. However, it does vary on if we're able to receive documentation such as your income verification and home ownership or landlord agreement, which we provide for you. It's just how fast you're able to get these materials to us and we're able to verify them. Does anyone have questions about the program specifically before I move on? I think this is the last slide I have here.
Yes, I have a question.
Hi, Naomi. Hi, how are you and
Hi.
Erin?
Good.
All right.
Good. Hi, Erin.
Hi, Morgan.
We had this program. It's a wonderful program, by the way. And we had the grab bars installed and even a railing into the garage.
Good.
My question is, once you've done this program, if you have a change, for example, my husband is now starting to use a walker, and can you reapply like for one of those ramps that once you've already done the program?
Certainly. I'll have to talk to our executive director, Diana, and Vanessa. Typically, no, but that was under our other funding. So this is an entirely different grant that we're operating under in the past. And you cannot be a duplicate participant for either grant. But because we're transferring to an entirely different grant that's federally funded, it might be an option. I need to check up on that, and I can do so for you right after the meeting and give yourself and Erin a call and inform you guys of what that response would be. I don't think it should be a problem though. So if the situation has changed, I think that we'll be able to provide that help for you under this new grant. But just know that the time frame is going to be a little longer with the funds at kind of a standstill at the moment until we open back up our government.
Okay, thank you.
Okay, I'll give you a call. You're welcome. You're welcome. Okay, let's put some things into perspective for you. So we know what these items are. Tim went into great detail about, the benefits, how they help, and how they're installed. But let's put a little bit more perspective into it and encourage you to, again, be proactive about this and preventing falls. So one of the greatest benefits I've seen in our clients after installing the grab bars is they're able to steady themselves while reaching for a towel. So that was always a big issue, is when they were reaching for the towel, either up, which already throws off your balance. If we're doing that upward reaching movement, we can seriously compromise our balance there, or reaching forward, which is even more dangerous. If we don't have something to secure ourselves, particularly in a soapy and slippery area such as a bathtub or shower combo. And so that's a benefit of a grab bar, vertical, horizontal, is being able to steady yourself while reaching for a towel, which is very important, especially in the winter. We want to put those towels on immediately. Handrails. We can safely take our laundry upstairs or items, or if you have a pampered dog like I do, you can hold your dog and take them upstairs. Hopefully they're under 5 pounds, but that's the benefit of handrails there, both in the home and outside the home. So if we're installing handrails on the outside of our home, like for example, the front entry and exit, that's going to be much easier for you to carry in your grocery items, to even pick up Amazon boxes. Say you get things delivered to your house quite frequently, you can always leave a note to your delivery driver to make sure that the box is left by a handrail, so we're not bending over without that handrail in place and compromising our balance. The transfer bench. You've seen the pictures that Tim showed you earlier of how ridiculously high those tubs can get. The edges of tubs are, very hard to overcome when you have mobility issues. So that the transfer bench, it looks very similar to a shower chair. It's got a little stick out part that hangs halfway into the tub, halfway onto the floor, and it just makes it easier to slide into the tub. Again, that detachable shower head, it helps you reduce that reaching movement that can throw off your balance. But when you're bathing, you don't have to twist your body, twerk it weirdly. There's no weird stretching to try and wash areas that are hard to reach. And you could sit, most importantly, while you have a detachable shower head. The threshold ramps are great if you need to roll a laundry cart, say you live in an apartment or a home that doesn't have in-home washer and dryer or shared laundry. The laundry carts, you could roll that in. That will make it much easier. You can get through it with walkers, canes. You can use the threshold ramp with your wheelchair, obviously. And then suitcases, because as we've learned in these Wellness Wednesday sessions, it is so important to maintain that socialization, because it goes into how physically active you are. That connects into the mental health. So I throw in suitcases just to bring in that comprehensive tie-in with how important it is to, one, be able to actually exit or enter your home safely, but to travel, socialize, be physically active. And then the toilet safety frame, very important for protecting your knees, hips, and even lower back strains, which can put you out for a long period of time. So that's what I have. I want to wrap this up and just say thank you all for making Wellness Wednesday so special for me. I really enjoyed this program and working with all of these professionals. We had Bonnie Rhea in April. She discussed brain health, dementia, Alzheimer's, and how it relates to fall prevention. We've had Dr. Robert Chin come on a few times, and he spoke about chronic conditions as well as osteoporosis. That one was a big hit amongst you all. We had Billy Scott come in and talk about hearing. We had Golden Bear Physical Therapy come in and talk about activities of daily living, as well as assistive devices, so a bit separate from the home safety devices that we've talked about here today, right? Those are your grabbers and your transfer belts. And then finally, we had Tim to really wrap it up, and it's been a joy for me. If you need to go back and watch these videos again, they will be on our website. We have many others. I hope that you utilize your resources and you consider the whole self when thinking of fall prevention. It's not just a trip. There are many complexities that go into it, and I will explain it one more time because I'm very passionate about it. The less we socialize, the less we move, The less we move, the less that we will socialize. The less we socialize, the worse our mental health gets. The worse our mental health gets, the less we move, right? These three components are very essential to preserving your independence and safety throughout your life. So move, socialize, and get that mental health up. If you need anything from me, you have my email. You can reach out, or you can email our main email here at healthy.aging2000. A staff member will be happy to assist you in any way. And just thank you all for your effort and your time in this program. I've really appreciated working amongst all of you and hearing your great questions. So that's all I have for today, and I'll see you all soon. Thank you so much for being here today.
Hey, Morgan.
Bye, Brandy. You take good care.
Oh, yeah. Fall detection monitors. Make sure you get one. Trust me.
Yes. Amazon. So if you can't, one more thing, if you are having trouble trying to afford something like a life alert system, Alexa, even Google Home is great. You could use Siri, but she's not very good at responding all the time. And what I'm saying is, if you have a fall inside the home and you were alone, Alexa would be you can program emergency contacts into Alexa, and you can shout, Alexa, please call 911, or please call mom or son, or you get the point. So great point there, Brandy.
Yep.
All right, all. You guys,
there you go.
you take good care, and thanks for being here today.
Yeah. Hey, and the graph bars are wonderful.
Oh, good. I'm glad you enjoy. I hope that we can meet any more needs that you might have. But thanks, everyone. Until
All right.
next time.
See you later.
Bye-bye.